Going live. Okay. Maybe I can get these cameras a little closer to each other. Okay, it looks like the YouTube is running. Let me just double check it because this is only the second night that I've been using this software and going on YouTube. So if you're there, just hang for a second. All this stuff is like new to me, all the everything that I'm using for YouTube, but I'm going to go start the Facebook Live and then we will get going. Oh my gosh, I have so many messages. Give me a second, guys. There's so many people that are messaging me, asking for help and asking me questions, so give me just a second. All right, now, I can't scroll down. Oh, what is going on here? All right, and I do have allergies, so you will see me do this quite often. And that, excuse me. Apologies. That's very attractive. Sorry, YouTube. All right, let's just go live on Facebook. Okay, now I am live on Facebook. This is made public. Okay, cool. Apologies, my allergies are still bugging me. Okay, guys, now I am live on Facebook and YouTube. Got a little bit of a different setup today. Kind of a corner in my very messy office that I need to straighten out. So, first of all, let me start by saying who I am. My name is Ginger. I'm also called the Pain Warrior Princess, and I have a chronic illness and chronic pain education organization called Pain Warrior USA. And basically, I'm doing live COVID-19 news updates every night. Being somebody who has chronic illnesses and who has had them for about 25 years, I've always been very careful because of the decreased immunity that I have and everything else. And it seems whenever there's something going around, I get sick. So I have always kind of done all these precautions that we are supposed to do right now. So I'm just kind of trying to help walk people through all of those, give you some tips and tricks that I know, and hope we can all stay safe and healthy. So let me get my stuff ready. I'm sure if you are here, then you have seen one of the posts somewhere of the topics that I'm going to cover. I cover those topics plus more every night. Whatever kind of news there was that I think is useful that came out in that day, I kind of translate it into everyday terms or examples that people can understand. Again, it's just because I've had chronic illness for so long, I understand what they're talking about when they're talking about clinical trials and medication and why you can't just give these patients these new drugs and just run with it. So, yeah. All right, let's see here. Unfortunately, my allergies are still bugging me, so. All right, let me pull up my notes. Okay, excuse me, let me get a little drink of water here. And I will apologize now. I'm expecting a delivery from one of the pharmacies that I use, and unfortunately, they're not here yet, and it's 8 o'clock my time, so I know they're like delivering all over the Phoenix area, which is huge. And so yeah, if I have to leave the video here for a minute and go take care of that, I will. I apologize if I have to do that, but all right. And my allergies are still kicking up. It just rained, so they shouldn't be that bad. Okay, so today let's start with the news from New York. Those of you who don't know, I was born in North Carolina, not far from Camp Lejeune, but I grew up basically in upstate New York, about 4 to 6 hours west of the city, just depending on, you know, what time in my life we're talking about. So I have a lot of family still in New York, some on Long Island, so I'm very worried about them. But I still have a lot of family all over New York. So basically today, Governor Cuomo, and just to be clear, when I'm talking about New York City, I'll say the city, When I say New York, I mean the whole state. So Governor Cuomo basically said, you know, if you don't have to be out, don't be out. And one thing that really bothered me that I was seeing a lot online is, well, that's shelter in place. And no, it's not. Shelter in place is like there's an atomic bomb about to drop. Stay in your home until we tell you you can get out. That is shelter in place kind of an idea. This is basically, if you don't need to be out, don't be out. There's a very contagious virus going around that they don't even understand fully yet. And I think a lot of people don't understand even partly why that's so dangerous. And that's bad. So if you understand, or even if you don't understand, please share the post that I'm putting up about why it's so dangerous. It's not even that it's just so dangerous for people like me or elderly people or, you know, younger kids with some chronic medical conditions and immunocompromised. It's dangerous because it's new. They don't know everything about it. They think it mostly spreads person to person and then community spread, which basically means, some people think that means airborne. It does not. If it were airborne, then, I mean, they could tell what city is going to get to next because they know where the wind is going. Does that make sense? I mean, I'm not a scientist, but that's what I understand. So yeah, it's very dangerous because of that. They think, like I said, person to person is the main way that it spreads. Then the community spread, which is basically they can't trace it back to a person like you sat next to on a plane or sneezed next to you in a bowling alley and then you shook their hand or whatever. So that's part of why it's so dangerous. They know that it lives on certain surfaces and it lives on them for a while. So I'm not trying to scare anybody. This is just the fact. When there's a new viral infection going around, it could be spread 10 other ways that they don't know about yet because they don't have enough data and it's so new. So this is a really scary thing for people like me and people who are sicker than me that have immune issues, and older people, of course, and even young people. I mean, they were saying, yeah, young people can get it. It just so happens if you're under 19 and you get it, you recover, but you still get really sick with it. So anyway, yeah, New York is not shelter in place. That would be a completely different thing. Yes, I know it sucks that you can't really go out of your house unless you absolutely have to, but it will suck worse if you get a viral infection and you're stuck in the ICU, or you get it, you're asymptomatic, you give it to your grandmother and she dies. I mean, that could happen. I'm not being dramatic. That could happen. So that's another reason why it's so scary, that people can be asymptomatic walking around and spreading it. And that's why in part of tonight's live, I wanted to talk about STDs, HIV, and COVID-19. Now, I'm not saying that people with one or the other will get all three. I'm not saying that, but there are a lot of related kind of things between them. And I'll explain what I mean by that. So let me just mark off what we talked about. We talked about Cuomo. Person to person. Okay. Another thing that I want to stress, that I stressed a lot last night, is, you know, people are like, oh, 15 days I have to be stuck in my house. This sucks. Well, let me tell you something. If, you know, and Trump said we'll reevaluate on day 14. If you don't do these things, I can tell you for sure on day 14, day 15, it's not going to be over. I can tell you that right now, because they don't understand enough about it. And they think they understand enough to kind of stop the spread of it with the measures that everyone is supposed to be taking. But it's not a guarantee. So just, if you have people in your family that don't want to do the precautions, or don't see why they're necessary, or think that it's overkill, or it's too much, or they're being dramatic, or whatever, that's really not the case at all. And no offense to your family or whatever, but they don't understand really what's going on with it. So another thing real quick that I touched on last night, because there's some confusion about this. Yesterday, Vice President Pence said, we're going to marshal the resources. And somebody said to me, oh, that's martial law. Well, no, it's not. First of all, they're spelled differently. Marshal the resources, which means gather them up, get them ready, get them out and used. That's kind of like the meaning of it. That's not, I'm like paraphrasing, but, and that's spelled like the last name probably a lot of you have seen, M-A-R-S-H-A-L-L. Martial law, M-A-R-T-I-A-L, is what everybody thinks is going on, but that's not what he was referring to yesterday. So And I do also want to say there was a stat. I don't like to give numbers about the virus, the number of infected and all of that, because they're scary numbers, first of all. And second of all, the numbers are going to be very, very high while the backlog of tests in the labs get put through. So I'm not going to talk about those for another couple days, at least. I don't even know if I ever will, honestly. But one number I did want to say, because this virus, it seems to take a long time to get over. Like some people are saying 25 days. Some people it could be even more, especially if you have medical conditions to begin with. But now numbers are starting to come out, and 87,000 people have recovered. So that's great news, and it took a while to come out because this virus is so nasty and stays in the system for so long. But 87,000 people have recovered. That means fully. That means they were tested and there's no viral load for this in their system. That's recovered. So again, because this virus takes so long, and it's a long incubation period, plus then it's the time that you're sick with it, we weren't really getting a lot of good news. But today they did say 87,000 people have recovered. So that's really great. All right, so pharmacies. Okay. Okay, so two other things I wanted to touch on before I get into the listed topics. One is pharmacies. You might, if you need to pick up a prescription, or even if it's just like a regular drugstore like CVS or Walgreens or Rite Aid, wherever you are, Osco, you might want to call ahead and check with a pharmacy to see what their procedure is, because like I use one that's closer to one of my doctors, and what they're doing, they said you can't come in the store. Either call us ahead and we'll do a curbside pickup, or we're delivering. Those are the only options right now. Now at Walmart, I had a script to pick up there, a prescription. Sorry, I'm using like patient jargon. And I called, and they were like, no, you can either come in or go through the drive-through. So it was almost like two extremes. And I'm not saying one was better than the other one, but I'm just saying if you have things you need from a pharmacy, your medications, your prescriptions, just call ahead, kind of see what their policy is. Even if they don't have any kind of restrictions or requests of you, I recommend the drive-through, just because that way you don't have to get out of your car, you don't have to walk through the store, you don't have to do any of that. So just go through the drive-through. Now, if you are in my neighborhood right now, you probably saw the post on our neighborhood Facebook page about the Walmart drive-through. Yes, they had some issues yesterday. The phone system was down for hours. And then when it did finally ring through, nobody answered. So, I mean, you can just imagine how swamped the Walmart employees are right now, regardless of what department they work in. So, but today the drive-through was back up and running because the phone system was back up and running, and they had 2 lanes of traffic. Now, I didn't go. My better half went, because I would prefer not to go out if I didn't need to, and he happened to have time to go. And there was a little bit of a wait, but the end result is I got my meds, and I'm a happy girl. Just waiting for a delivery today from one pharmacy, another one on Monday. I'm kind of concerned, honestly. It's 8:15 and I haven't gotten it yet. Normally, if they deliver to me, it's by 5:30. But I know they've had to hire other delivery companies and everything. This is just a crazy situation. So the testing procedure, there was a video that I saw yesterday. I know a lot of people are so curious about this whole drive-through testing procedure, how that works. Someone posted a video yesterday that I happened to see. I sent her a message and I said, hey, do you mind if I use this video and this live videos thing that I'm doing? I explained it all to her, but I didn't hear back. I didn't realize that she is actually a journalist in Philadelphia. I didn't realize that. So, maybe I'll make a new friend out there. But she detailed the drive-through testing procedure and what she had to do before she went to that drive-through. So obviously, if you think that you have symptoms of this, call your doctor first. From my understanding, from what she said in the video and what I've read and seen in other places, your doctor actually needs to call ahead to the drive-through testing facility with an order for you to get a test, just like any other lab, right? If you go and your doctor wants a CBC or a thyroid level or whatever, you have to get a lab order for that. Same deal. The only thing is you don't have to carry the paper when you go to the drive-through, unless you actually physically go into the doctor. But from what I understand, they call the testing site ahead of time. And from what she showed, I would love to be able to show you guys the video, but I don't have her permission yet, so I'm not comfortable doing that. Even though she made it public, it's not public on my stuff, it's public on her stuff. So anyway, so she did have symptoms. She called to her doctor, who called in an order for the drive-through testing center. So she went, she drove up. A nurse in PPE, head to toe, kind of explained to her what the process was going to be in the testing facility. It was an uncomfortable test, and the nurse said that ahead of time. They take 3 swabs. They take 2 in each nostril. Well, sorry, 2 in the nose, so 1 in each nostril, and 1 in the throat. From what she said, they go deep. If you've ever had a strep throat test, from what I understand, that's a little bit less invasive than this test, but that's where the virus lives, way in the back of the throat, way up in the nose. So that's how they do it. But it's very simple. It's very quick. It's really nothing. I mean, 2 seconds of discomfort. That's about it, and you're fine afterwards. So she just drove through. The nurse explained to her what was going to happen, and swabbed her. And he said all 3 of these swabs came out perfect test. And then she went. And then she went home, and now she is self-quarantining. And I wish her nothing but the best. I hope you're feeling better, and I hope that your tests come back negative. But thank you so much for sharing all that information, and I hope you're feeling better. Okay, so let's see what the list is. I have a lot of questions again today from you guys. Thank you so much. Before we go any further, if you're watching on Facebook, I recently, so yesterday, figured out how to live stream these on YouTube. So I'm also doing these on YouTube. Again, people are like, why are you doing this? I'm only doing this to help everybody else because, again, I'm familiar with these terms. I understand this. I understand all the precautions. I basically do them myself all the time. And I have 13 YouTube subscribers as of right before I went on, and I'm sure when I leave there will be that many. So I don't even have enough YouTube subscribers to get close to making any kind of ad revenue. So I'm not doing this for anything like that. It's just YouTube has a bigger audience. They recommend videos. It's a platform that has a lot of people that go to it. That's why. So if you're on Facebook and you prefer to watch on YouTube, there are instructions in today's list of topics on how to do that. There's also a link to the YouTube channel. Now you can paste that link either in your browser or in your YouTube app, and it will bring up my channel. So all you have to do is subscribe to that, and then I really recommend that you turn on all notifications because I set up the lives as events, and then you can ask to be reminded, or you'll get a notification when it happens. So if you prefer YouTube, now that is set up, I'm getting more high tech, so you can go there. All right, before I get to the press conference, there were 2 other things that I wanted to go over with you. One was an interview with Dr. Jerome Adams. If you don't know that name, you certainly know the position that he has. He's the Surgeon General of the United States. And he said he said a lot of things, but one of the most important things is, remember yesterday that I mentioned that President Trump tasked the task force with finding a drug now that can be used, one 30 days from now, and one, 6 months from now, I think, and then the vaccine in 2021. I know at least the first 2 are now, and then a month from now, right? I don't want to give you guys wrong information. I hate that, so I'm going to look it up. Okay, drug now, 30 days from now, next fall, and then the vaccine in 2021. So the reason for that, just quick, if you weren't here yesterday, having a drug now, obviously the benefits of that are get it into people, see if it works on them. The drugs that they mentioned, I always forget this, hydroxychlor something. This is so embarrassing. I knew it. You know what it is? I wrote it down somewhere else, and then I was looking at my medication names earlier, and that's why I got confused. I'm going to say it, and now I have to. If I don't say it, I'm going to look like a fool. Hydroxychloroquine. There it goes. And remdesivir. These are drugs that are used for other things. And by the way, let me explain one more time, because somebody last night was like, they don't know what they're doing. This is an Ebola drug. Well, symptoms is Ebola. The drug is not being used to treat the symptoms. The drug is being used to treat the cough and but the drug can be the same because it attacks the virus in your body. All right, and we talked last night about why they can't just start pouring this drug down people's throats. So if you're curious about that, go ahead and watch last night's video. Again, this is just something I'm familiar with because I take many medications and I've researched them all before I did it, and I wanted to understand the process of how they figure out if it's safe or not. So that's my source for that. So anyway, Dr. Jerome Adams said that there are 3 tiers of kind of preventing this COVID-19 from coming back and circulating again. Is mitigation. That's how all these new novel diseases with tissue and throw it out immediately. I prefer the elbow because the tissue, I've sneezed through or coughed through one before. You probably have too, but I prefer the elbow. Another tip that I gave before, if you're going to scratch your face when you're out, you can always use the back of your hand. Just make sure when you're washing your hands, you wash that area, okay? But this is a habit that I've gotten into years ago, so it might be something for you to do too. But anyway, tier 1 is always going to be mitigation when it's a new viral infection because they, like I said before, they don't know enough about it. They don't exactly know, beyond the shadow of any kind of doubt, 10,000% absolutely sure how it all spreads. They think it's person to person. Then they think it's community, which is not airborne. It just means they can't trace a person in your history that has it and gave it to you. Hey, Danielle, you're a pretty lady. I loved all those things that you put in your story about kids being homeschooled. And the one about a whole bunch of parents are about to find out it's not the teacher. That cracked me up. That was good. So yeah, Dr. Jerome Adams, our Surgeon General, said tier 1 is always mitigation. So that is, like we talked about, washing hands and all of that, self-isolating if you have symptoms, quarantining, well, self-isolating if you think you're sick, quarantining if you have symptoms and you've been tested and it comes back positive, of course. Social distancing, not going out if you don't have to, all of this kind of stuff. Tier 2 is therapeutics. Therapeutics are the medications. So hopefully by the summer, they're going to have several options for this. Someone had asked me, well, they have 2 drugs right now that show promise. Why do they need more? Well, there's a limited supply of those 2 drugs. So when you're trying to fight a viral infection that you don't quite understand beyond the shadow of a doubt, how it spreads, and a lot of people have gotten infected with it, you don't want to only have 1 or 2 medications because those 1 or 2 medications could run out. I'm not saying they would. I'm not saying we don't have enough, but I'm saying this is why it's smart to have backups, right? You have backups in a lot of things in your life, so it makes sense to have it here too. Tier 3 is a vaccine. Again, they talked about that being in 2021. So that was Dr. Jerome Adams. The news from him today, the Surgeon General. Is that my delivery from the pharmacy? No. Okay, I thought I heard the bell. Sorry. FEMA. Now, this is another serious situation, and now FEMA can work directly with the states. Y'all know there's so much bureaucracy, bureaucracy and red tape and bullshit. They have removed this now for this situation, so FEMA can work directly with the states and get them help quicker, get them the PPE that they need to the states, get them any other kind of help that they can. So that's a really awesome thing. All right, now the press conference and news from that. I'm going to be honest with y'all. I didn't find there to be too much brand new virus-specific news. I'm sure you've all heard by now, closing the borders, Mexico and Canada to non-essential travel, and illegal immigrants being turned away at the border. I'm sure this is going to get political. I don't want it to. I just want to talk to you about my experience of being with someone who was a legal immigrant. There are different things that happen when someone comes into our country legally. He was health tested. They did some other things when he came in. But the most important thing is that he was health tested when he came here. If somebody just comes over the border and they're not tested for any of these things, then obviously they can bring them in and give them to other people. And when there's a viral infection going around that is incredibly contagious, that's a dangerous thing for our country and for the people trying to come in. Because if they're caught, they'll go into one of the detention centers. And if that viral infection gets in there and spreads, it's going to be tragic, not only for them, but for the people that work there and their families. It's going to be really bad. So I'm not talking about whether illegal immigrants should come here or not. That's not what this is about. So please don't go there. But I'm just explaining what I know about the difference when somebody comes in our country legally and somebody comes another way. So that is designed hopefully to protect, or that is designed to protect us, hopefully, from this virus getting worse. So yeah, ban on non-essential travel. I'm just making sure that I have all this down. Okay. Dr. Birx also spoke, and don't worry, I am going to get to the part of the press conference where the reporter got kind of ripped a new one for what he said, and I'll tell you my take on it. Let me just tease it and say it's very clear that this reporter doesn't know anything about medical stuff like this, but that's for later. Dr. Birx, we talked about if they're 19 and under, they have the disease, they recover, but they can still get very sick with it. One thing that came out of Italy that I thought was very interesting is the mortality rate there is 2 times in men what it is in women. So that's kind of not a great thing if you're a man. So obviously, you don't want to get this virus, whether you're a man or a woman, really, but especially not if you're a man, right? So wash your hands, boys. All right. Okay, she did have a message directed toward parents, and it was basically to moms and dads in general, but especially those of immune compromised or kids with medical conditions. They just don't know the risk to kids like that yet. There's just not enough data. So obviously, you know what to do if your kid is immune compromised and has medical conditions. I'm sure you've been doing it for as long as you knew that they were immune compromised. But there are some myths going around that kids are immune to this, and that's just not true. No one has immunity to this particular virus. We all have wellness immunity at some level or not. So when I say I have decreased immunity or I'm a little bit immune deficient, I'm talking about wellness immunity, just to be clear about that. Nobody has this immunity to this virus unless they've had it and they recovered, and that's what the scientists find out. That's usually how immunity to a certain strain of a virus works. Okay. You know, and just to explain, that's why when the flu goes around your house, you don't get it again, right? Because it goes like your kid brings it home and gives it to you and you give it to dad. But the kid goes back to school, well, there might still be sickness. But he doesn't bring it through the house again because y'all had that strain of the flu. So that's kind of just a quick aside, just to explain. All right, and obviously they reminded us again to follow the guidelines. Super, super important. And another thing that I think a lot of people are not understanding, they think that because the task force is telling us that most of the people who get this will have mild symptoms, and some people are confusing mild symptoms with contagiousness. That they're not related at all, dude. Like, you can have a mild sickness and pass it around. Just because you have mild symptoms doesn't mean that you're not contagious. Especially because we know this virus you can be asymptomatic and still have it and still spread it. So please don't confuse the level or severity of symptoms with the contagiousness. I did a post about this before when people were talking about seriousness of the virus. It's not necessarily that the virus is always serious with everybody. It's that the contagion rate is very serious and very high and very severe. So don't confuse those two, okay? Mild symptoms does not mean it's not very contagious. It means when you get it, you will probably have mild symptoms. That's all it means. Doesn't mean that you are less likely to get it. Not at all. Okay. And then Dr. Fauci spoke. I said Dr. Fauci the other night, and I'm so embarrassed, but I have a friend with the last name Fauci. Fauci. I said it both ways the other night. Fauci. Hi, Sunday. Hi, Sean. So Dr. Fauci said, of course, to keep this under control. This is literally a public health thing. Okay, guys, this is a very serious thing. a lot of you know there's like public health departments, but you don't know what they do. This is what they do. And they don't ever want to have to do this job. It's part of what they do. And they don't ever want to have to do this job because it's scary. And they don't know enough about this virus, like I keep saying. And it's very difficult to get people to do all these draconian measures when they really don't understand it. I'm really learning how many people don't, and this is not, I'm not digging at anybody, I'm not busting on you at all, just don't really have any experience with like being sick or needing medication or stuff like that. And it's interesting to me because I've never really looked at, you know, kind of what I deal with as an advantage, but I guess in some cases it is, like maybe this one, and I can help you guys understand stuff. But anyway, yes, this is definitely a public health situation. And he did talk a little bit about closing the borders north and south to non-essential travel, and the thing we talked about with the illegal immigrants. This is one of the ways that we will keep ourselves more healthy. We have to prevent the infection from going around our country from the people who are in our country, so within, and we have to stop it from spreading so much from without to within. So yes, we have to stop it within our country, but we have to stop it from coming into our country too, by any way we can. Flights, land borders, whatever it is, we have to do that. So that's the thing about the borders. That's the thing about the flight bans. It has nothing to do with anybody's nationality. It has to do with the virus can get here from outside of our country. It can run around within our country. So we're trying to protect ourselves and not get so many people sick. So this is why we have to do these things. He also reminded us, of course, to cooperate with the guidelines, guys. I have said it 92 million times, probably just tonight. We really have to do that, or a lot more people are going to get sick. And we already know in New York City, and in LA, it's a scary situation because of the resources. And I don't even mean just the PPE, the personal protective equipment. I mean resources as in people, as in trained, skilled people who can care for these patients. From what I understood before all of this kind of got so bad, not any nurse, for example, can just walk into the ICU and start treating patients. If I'm wrong about that, I know two of my friends that are nurses were on here at some point. I don't know if you're still here or not, but if you are, can you kind of weigh in on that? Am I right? Am I wrong? Am I not explaining it right? Yeah, so there's, from what I understand, you can't just walk into the ICU and say, hey, I'm a nurse and I'm here. It doesn't quite work that way. I think since things started to get more serious in those cities, that maybe they have changed some of those things. It makes sense to me that they would, but if you do need to go to the ICU, that's a very serious situation. So we are trying to make it so that doesn't get so bad. Vice President Pence came on and talked about more industrial companies and construction companies and in any kind of company really coming forward and offering their PPE, like we talked about last night with the construction companies. They're coming forward and giving booties and Tyvek suits and N95 masks and all of that stuff to hospitals. They're donating it. The Gary Sinise Foundation donated over 3,200 pieces of PPE to, I think, 31 or 32 first responders across the country. And I think it's like first responder departments, so like a fire department or this or that. So they're doing a lot of stuff. I even contacted the White House today and I'm like, look, I know you have writers and editors and proofreaders on your staff. I'm sure they're inundated right now. That's one of the skills I have. If I can help in any way, let me know. I'm sure they're not going to take me up on it because I'm sure all this information is classified and I probably don't have any kind of security clearance. Or maybe I was in the CIA. I'll never tell. But I like Homeland. So anyway, you know, if you can do something to help, go ahead and step forward. You don't, it doesn't have to be at the White House. Like I kept talking about before, if you got a box of masks and you're not sick, you might consider calling the hospital, your local hospital, and saying, hey, I bought these. I thought I would need them. They're not opened. Keep them unopened. I'll explain in a minute. and say, hey, you know, is it cool? It's a box of 100. Can I come down and I'll give you guys 90, just give me back 10 just in case my family gets sick or to keep us safe. I am pretty sure that they will not turn you down on that. So yeah, people are coming forward offering help. If you were on the live last night, and I'm saying this so you understand, it can be a big thing like donating PPE, or it can be a small thing like what I'm about to tell you. Anything that you can do to help would be great right now. One of my neighbors couldn't find soy sauce in the stores. One of my neighbors couldn't find hand sanitizer, and she has an immune compromised son. So it's little things like that that you can do to help. Oh, I didn't tell you the end of the story. The end of the story is I helped her. I helped him out. So you can do little things like that, and that still helps, you know. All right, so let me make sure I got everything on this page. Oh, all right. So let's talk about the thing with a reporter. Here's what the reporter said, if you didn't catch it. And by the way, stick around. We are going to do an experiment in a little bit with rubbing alcohol and ink. Remember I said in the topics tonight, rubbing alcohol, I should say isopropyl alcohol, I should be very specific, and ink. These are 2 old prescription bottles of mine. This one happened to be filled with medical cannabis when I had my card. This one was not. It's filled with something else. Okay, so the reporter basically said, you know, your impulse to put a positive spin on everything, isn't that giving false hope? It was so clear to me that this dude has never had any condition that the doctor gives you a medicine, or a nurse practitioner gives you a medicine and says, well, I think it'll help. You know how many times I've had that happen in my life with all the shit that I deal with? It has happened literally so many times. In the way that he said that, it was just, to me, it was like, I got it. He's never been sick. He's never gone through that. If you also haven't gone through that, I'm here to explain. It happens quite often. I'll give you some examples from my life just so you understand. It's not false hope. It's called reality. Fibromyalgia. I was diagnosed when I was 19, and that was after 3 years of trying to figure out a doctor who could tell me what was going on. That's one of the things I have. So I have been on so many different classes of medications. They used to start fibromyalgia patients on NSAIDs, and I couldn't tolerate it. It was back then, it was called Voltaren, and it was naproxen sodium, which now is the ingredient in Aleve, and it's over the counter, which it has been for years. But so back then, that's what they gave me. And it made my stomach hurt like a mother. It didn't help my pain. It didn't do anything. And then a couple years later, it comes out, oh, NSAIDs, can't do them for fibromyalgia. So was the doctor giving me false hope when he said, we have this drug and it has worked for other people? Just like they're talking about with these other drugs, the hydroxychloroquine and the remdesivir. No, he wasn't giving me false hope. That was the best information that they had about fibromyalgia at the time. So no, it's not false hope when Trump says, yeah, I have a good feeling about it. It's just reality. And if you've ever had a condition where there's no clear treatment for, you would understand that. But if you haven't, I'm here to explain it. So no, it's not false hope. After the NSAID, and it was a prescription NSAID, like I said, then we went to antidepressant. And antidepressants were thought back then to help fibromyalgia patients sleep. And if we got better and deeper sleep, then we would have less pain. I guess our brain was working overtime when we were deep sleeping and repairing our muscles. That didn't work. And I went through 4 or 5 antidepressants because they kept saying, oh, that one didn't work. Let's try this one. Oh, 3 weeks later. That one, oh, you can't tolerate those side effects? Okay, let's try this one. 2 months later, let's try another one. So that it's absolutely not false hope. They're going with the best information that they have. Again, you guys got to keep remembering, this is a brand new virus. Brand new. Yes, there were coronaviruses before this one, but this strain is different. So it's absolutely not false hope what they're saying about these drugs. I don't want anyone to think that it is. just a real quick ending to that part I was talking about with the fibromyalgia. I have been tried. I made a list one time for a doctor a couple years ago. I have been tried on over 60 medications since I was 19. Different classes of them, different strengths of them, different ways to take them, like pills versus shots versus whatever. So a doctor was not giving me false hope that many times. It's just, this is the best information we have to go with, so let's try this. So I just wanted to explain that because, yeah, I was kind of annoyed with a reporter when he said that. First of all, it's just an asshole move. I mean, why is it false hope? If anybody had a good feeling about it, why is it false hope? It's hope. Why do you put a false in front of it? Nobody was being false about it, but, and then, yeah, Trump kind of scolded him about that, but, and they also said something else I really want to touch on too, and it's kind of related to what I was just talking about, but let me get a sip of water if you don't mind, because I've been chit-chatting for a little while. Ooh, I got a little Jessica Rabbit kind of thing going on in my wave, in my hairs. Okay, so in my opinion, okay, they tried to make it seem like there was a disconnect between what President Trump was saying about the hope he has, and he has a good feeling about this, and what Dr. Fauci was saying. The funny thing is, they were saying the same thing, but from different perspectives. I really want you guys to understand this. Dr. Fauci is thinking from a scientist, a doctor, an empirical, and I need to prove this point of view. But he still is hopeful, right? And Trump was thinking more from a, yeah, it sounds like it's going to work. It's worked with these people. I have a lot of hope. So they were really saying the same things. It's just they're basing their hope on different things, in different experiences, in different, I almost want to say, no, I'm not going to say that word because somebody will say, well, he doesn't have that. They were coming at it from different perspectives, but they were basically saying the same thing. And the reason why I know that, y'all know I like to give you my sources. The reason why I know that is because I've been to so many doctors over my life for different things. I know I kind of focus on the fibromyalgia, but I have 10 different conditions that have been diagnosed. Plus, I also have some new ones they found with a blood test that I mentioned that I got back a little over a month. No, almost, no. Yeah, about 6 weeks ago. No, something like that. So I have that shit on top of it that has to do with my immunity. But the point is that I have heard from many doctors, and, you know, when somebody would go with me in a doctor appointment, and the doctor would talk about the medication, the person with me would say, do you think it's going to work? Well, obviously he thinks there's some kind of chance or he wouldn't give it to me, right? So that's kind of an example of this. It's different perspectives coming and looking at the same thing and then stating what they believe based on that. So there really was no disconnect between the two of them. So if you read that, that was probably sensationalism or BS or trying to, like I said before, all these reporters, and I don't mean 100% of the reporters are doing this, but all these reporters, they want to get a scoop because that's what reporters are supposed to do. They're supposed to be first with the news. That's called a scoop. There's not a whole lot to scoop here, number one. Number two, the government and the task force is scooping everybody and anybody because they're the ones delivering the information. And that's a very difficult thing for a reporter to accept, that they're not first with the news, because that's what they want to be. That's a great thing when you're a reporter. It's kind of like one of their goals, I think, and I don't mean that in a negative way. It's just in this situation, that's not going to happen. So I think sometimes they try to find a story when there's not, but there was no disconnect between President Trump and Dr. Fauci and what they were saying, just different perspectives. And also, it's not false hope. It's not false hope to think that the medications that were mentioned will help in this situation. Let me be clear. Okay, guys, let's see what else is on the list. I went through the press conference. Okay, you know what? I want to skip down right quick to how I handled the groceries that we got today. First of all, I did not go out. And second of all, this is going to sound like I'm being paranoid, obsessive, OCD, and a little bit wacko about this. But let me explain to you why. I really, really don't want to get sick with anything. And this whole COVID-19 situation has made me realize that there are some things that I could even up my being vigilant about. But I cannot be too careful right now. And this is an easy procedure. And if it makes you emotionally feel better, I don't think there's anything wrong with it. This is a very scary time. It's a very uncertain time. So if wiping some of the things you bring in your house with a Clorox wipe will make you feel better and you have them, do it. I mean, don't spray Lysol in your husband's eyes. Don't do that. But if it's harmless to other people and it makes you feel better, I say go ahead. So that's what I did. He went to Sprouts, which is kind of like a more natural, organic food market, and got some frozen, two bags of frozen fries, some plant milk creamers, some plant milk. What else? Got my prescription from Walmart, which was in a paper bag, stapled, and of course the prescription bottle is plastic, and the paper was on the outside. What else did we get from Sprouts? Orange juice in a plastic container. So what we did, we have kind of a staging area. I'm going to take this shoe off because it's hurting my foot. I'm just getting cozy. All right. So, we kind of have a staging area in our garage. This might be very useful information if you do have immune compromised folks in your house, or you're in one of the areas that are hardest hit or kind of next to them, close to them. Not to panic anybody, it's just a good idea to kind of keep this in mind. In our garage, we have a big work table, and that is kind of our staging area for things that we want to bring in the house right now. In our home, like I mentioned last night, we enter through the garage. We could enter through the front door, but we don't. It's easier to enter through the garage, so we do that. And so we have that big table, and we just put all the bags there. I went out to the garage because I told him, I said, I will take care of all of this for our house, because I know it's a little bit on the extra side, and I'm a little bit extra in some things in my life, and this is going to be one of them for the foreseeable future. So I said I will take care of it. What I did, I took all the items out of the bags and I put them on the table. I gathered up the shopping bags, I put them in the trash, and then I just wiped what we got with a Clorox wipe. It took like 2 minutes, made me feel better, and so I did it. Now, one thing I want you to remember, though, if you're going to do this, let me just grab, speaking of Clorox wipes, because we have a demo with that tonight too. Make sure you wipe the bottom of whatever you're wiping too. And by the way, from that work table, so like the groceries were on this side, okay? I picked them up, I wiped them, and then I put them on that side, okay? So make sure if you're going to do that, you put what you have cleaned in a clean area. But, so yeah, plastic bottle of orange juice, like a wax-coated cardboard. You know what milk comes in when it's in a carton. We had some of those. My prescription bottle, especially, I disinfected the M or F-er out of. And I did that. Wait, is that the delivery guy? I guess not. Okay. I'll be honest. I went to town on that sucker because it's coming from a pharmacy, and there might be sick people in the pharmacy, even if it's not COVID-19. I don't know. But it took me 3 seconds to wipe it with a Clorox wipe, and it made me feel better. So I did that. At the present time, both of those are still in the garage, kind of hanging out, because like I said, there was some paper that came with a prescription that was on the outside of the bag, and I didn't go out today. I don't want to. So it's just sitting out there. It's going to sit out there for a couple days until I would like to bring it in my home. So that's it. Again, if it makes you feel better at this very uncertain, scary time to wipe your groceries with a Clorox wipe, go for it. But isopropyl alcohol is not the best thing for that, and I'm going to show you an example of why. Here's a little tease. Just a tease. I ain't showing you the whole thing. So that was how I processed groceries that came into my house. And of course, when I was done with that, I cleaned my hands. Then I took the clean groceries into the house, took care of them. Then I came back out to the garage. I wiped the table and sanitized that where we staged the groceries when we first brought them home. Then I sanitized my hands again, and then I came in the house because I was touching handles and stuff when I came in. And then I just washed my hands with soap and water because after that, I was going to take care of my clean dishes. So I made sure that my hands were scrub-a-dub clean before I did that. So that's how I handle the groceries. If you have any questions about that, please feel free to let me know. Again, it's a scary time right now. So if you want to wipe your groceries with a Clorox wipe, I don't give a damn what they say on TV. Do it. You have my permission. If you want it. Okay. All right. Let's talk next about, you know what? Let me see here. All right. I did talk about all that. So we're going to do some experiments, and then we're going to talk about STDs, HIV, and COVID-19. No, I am not saying that if somebody has one, they have all three. I'm not saying anything like that. I'm saying the epidemics are the same, and I want to explain to you why. And I think with that knowledge and information, a lot of people who don't understand why we need to take all these precautions may understand a little bit better. So let's do an experiment. All right. I love experiments. So this is, as you can see on their YouTube too. Oh, that is a nice picture. Okay. This is a 78 wet wipe container. Now, it is almost empty. I do not want you to think that I have used 78 wipes since all this nonsense started. It is a very old container of them. It's still like moist like it's supposed to be, but I don't want y'all to think I'm going crazy ape shit to town and using like 12 of these a second. So, here's my little Clorox / Lysol / generic brand wipes. Secret, doesn't matter what brand. Let me see if you can hear this. I don't know if you can, but let's try. Could you guys hear that? Could you guys hear all the liquid in there? So there's like 2 wipes left in here. So we're going to actually have 2 secrets today. First of all, you can do that, number 1. Number 2, do you guys see the cleaner dripping from this thing? Oh, it's all over me. If you couldn't see it, trust me, it was dripping. So here's one of 2 secrets, okay? I told y'all I was going to help you get the most out of all these supplies that you bought, but I'm going to have to do it where you can see it. So, I know I'm not suggesting you take the top off and dig through these. I'm only doing this because there's so few left and I couldn't get them out of the thing. All right, so let's see if you can see it now. I just tore off a wipe. Ready? Did you see all that? Oh my God. It's like in my armpit right now. Oh God. Ew. Show must go on. God. Okay, so this is still, listen, can you hear it? I don't know if you can hear it, but it's still wet. It's still like soaking wet. So one of my secrets is there's a hell of a lot of liquid in here, especially when you get to the bottom. I don't know if, can you guys see? It's like wet on there. I squeezed out a whole bunch of that. So one of my tips is you can squeeze the liquid out of here. Not bone dry. I mean, don't like twist it for days and days, but do it like I did and then use the wipe. Because what you're going to do next when you get to the bottom of your container, where'd they go? Here they are. Here's what I do. Here's like one of my best money-saving tips. So, if you buy these kind of paper towels, they are perfect for this. You know, the ones where you can like choose the size. So, I'm not going to do this with a ton of paper towels because I only have like a certain amount of rolls left and I haven't gone to the store to buy more and I don't want to run out. But I'm going to take the other wipes out of here so I can show you this. Dear God, don't go down in my armpit again. That's nasty. My armpit does not need to be sanitized from COVID-19. All right. So, I don't know if you can see it. I don't want to, like, spill it out, and I'm, like, trying. All right. That's not going to work. All right. So, anyway, take the paper towels. I'm going to use 4 half sheets right now. And this is all I do. Fold them in half. Then I shove them in there. And then you have new wipes with all that liquid at the bottom. Now, I put 4 half sheets of paper towel in here. They are soaking wet. Let me show you how much liquid is in the bottom of these suckers. So, even if you have used all of your Clorox wipes, if you haven't squeezed them out, and now you're just learning this trick, save the container when they are done, because there will still be some liquid at the bottom. Then you take half sheets of paper towel, or bigger if you want to do bigger, but I do half sheets because that's usually sufficient, and then put them in there, and then you have new wipes. So that's a tip from me. And by the way, they will stay wet in here. Mine have done up to at least a month, and I live in a very dry climate. So that's a tip. I hope it helps you guys. I know that certain supplies are a little bit limited in the stores right now, so I thought that might come in handy. Speaking of handy, I actually need a Clorox wipe for my next demonstration. So what do you guys think? Did you guys know about that tip before? About squeezing the wipes out a little bit and then harvesting, I guess? If you smoke cannabis, you probably harvest certain things out of your bong, right? Harvesting that liquid at the bottom. I thought it was a cool tip. And I'm cheap, so frugal, I think, is the nice way to say that. Okay, here's our next experiment. Isopropyl alcohol. My hands are still wet from the Clorox wipes. So is my pit. All right. Isopropyl alcohol and inks, for the most part, do not mix. Now, if you have coated ink on a certain container, you might be okay. But what I wanted to show you, and again, it's because I just have a lot of experience with all these cleaning products and sanitizing products. So this is something that I've learned over the years. And I kind of mentioned it a little bit last night when I sanitized our mail, when I was talking about that. But let me do it here so you can see. And I'm trying to figure out how to do it so I don't get rubbing out or isopropyl alcohol over me. Here, give me 1 sec to, we'll just do this. All right. So, sorry, I just inhaled like cleaner fumes. Come on down here where we can see. All right. So this is just to catch the isopropyl alcohol. This has nothing to do with what I'm going to show you. But you can see the ink on here, right? If I knew how to hold something straight in front of a camera and a mirror image, you could see it. Okay. So this is my rubbing alcohol, right? Told you guys about my rubbing alcohol. Going to spray it. And what this demonstration is going to show you basically is there are certain things that rubbing alcohol is not good for because it will destroy what it says on the package. So here, we're going to spray that guy. I just refilled my alcohol, so there we go. So this is interesting. It did not do it with this label. So yeah, it is some inks. Like I said, it's not all inks, but so certain inks you can see. This is covered in rubbing alcohol and it's fine. Very interesting. Let's try another one. Same with this one. Okay. So these inks are okay. I do know with some, though, it's going to get messed up. I just got to find one that it will. Let's try just regular pen ink. My notes from 2 nights ago. Let's see. Yep, there she goes. So you can see the ink is starting to run. So there are certain inks that you should not, certain inks used on some packaging that you should not sanitize the package with isopropyl alcohol. That's what I was trying to say. So as you can see, the ink runs, keeps running. So yeah, just kind of be careful and mindful of that. If you are not sure if the isopropyl alcohol will do that or not, use a Clorox wipe. I used Clorox wipes on the groceries that we got today that I wanted to take care of, and it worked perfectly fine. So just kind of keep that in mind. Keep a lookout for that. And let's see what else is on the list. I'm still going to get to your questions. No worries. Okay. All right. Honestly, I'm not sure how this is going to go over with people, but it kind of struck me, so I wanted to talk about it. And I was hoping, that's Marilyn Monroe back there, by the way, if you can see a naked arm. Marilyn, say hi. Hi. Okay. So it kind of struck me how similar the HIV, when it first came out, in the 80s, New York City was very hard hit. So were certain areas in California. But it struck me how similar epidemics of STDs, HIV, and COVID-19 are. So if you're not an old lady like me, you don't swallow water wrong. You might not know that HIV, the virus, it's a virus that causes AIDS, acquired immune deficiency syndrome, hit really, really hard. I remember it like early 80s. Like, I don't want to give the year, but I know it was early 80s. And they weren't sure really what it was. They called it a cancer to begin with. They really weren't sure about it. But as more data came in, as more patients showed up with these symptoms, kind of like what's going on with COVID-19, they were able to figure out, it looks like this virus is spread through what's that word? Oh my God. Sexually transmitted. Sorry guys, it's been a day. They started to realize that it was spreading faster in certain groups, and it hit the gay population very, very hard. It was incredibly sad. There were so many people getting sick and so many funerals, and everybody was scared and they weren't sure exactly how it gets passed. And, you know, if I want to have sex with this person, is this thing safe to do, or can we do it this way instead, or what are we supposed to do? So it's very similar to what's going on now in terms of, well, you know, we know it spreads person to person. We know it spreads at community. We're not really sure if it spreads this other way. But what I really wanted to focus on is the way that it was handled. The way that it was handled was, there are things called bathhouses. And in bathhouses, one of the activities that happen is gay men like to get together and be intimate. And one of the recommendations when HIV was they were kind of figuring it out, right? And they were figuring out how it spread. So one of the recommendations was, and they had signs all over the bathhouses. By the way, there's somebody from New York City that I know on Instagram. He posts a lot of this kind of stuff, like history of gay culture in New York City. So this is sourced from him and from my own knowledge and memory and research that I had done on this for before. So they were telling these gay men, you can go to the bathhouse, but don't have sex. Or if you're going to have sex, use condoms. And people didn't want to, really. That wasn't their jam. They didn't enjoy that. So HIV kept spreading. My point with that is we are being told exactly what we need to do to stop this virus from spreading and a lot more people getting sick. But we don't want to do it, right? A lot of us don't want to do it. But what you're not realizing is like what happened with the HIV epidemic. It started showing up in heterosexual people. And heterosexual people from back then are analogous to young, I don't think I can get sick, what's the big deal, people now. Back then, they were like, oh, it's a gay disease. I don't have to worry about that. But then they started seeing it in intravenous drug users, and they started seeing it in heterosexual women and men, of course. But they were like, what the hell? How did that happen? So that's kind of what's going on now. And there are young people that are getting very sick with COVID-19. They assume they had immunity. Why? I don't know. We're all saying nobody has immunity to this particular virus, but they're just going to go out on the beach and hang out and probably hook up and spread the disease back to their family. I mean, there's a lot that can go wrong with that scenario, but I hope you can kind of see the ties in with this and why I brought it up. Back then, they were going with the best information they had about the HIV virus. It was new back then, just like COVID-19 is new now. I am not saying that COVID-19 is spread the same way as HIV. I'm not saying that. What the analogy is it's a new virus. They weren't exactly sure how it spread. They were telling people what to do to not get HIV, and people were doing what they wanted to anyway. That is the analogous situation. Now, The good part is, and I wanted to have some statistics about this, but I didn't hear back from that guy on Instagram about it. But eventually, people started realizing that we need to use condoms. We need to practice safe sex. This is not just a gay disease. This is something that if someone is an IV drug user, they need to have clean needles. We cannot share needles. Once they started realizing all of this stuff and implementing it, HIV stopped spreading so quickly. That's what we need here. We need this viral infection to stop spreading so quickly. That's why you need to stay in your home. You need to follow the guidelines. That's why we close the borders. That's why we're not letting flights in from certain places. That's why we are doing all of these different things. So maybe if you think of it kind of in terms like that, and I know a lot of young people who are thinking they're not even going to get sick probably don't even know what HIV is or never heard of it, but it's a very similar situation to me. Now, I did include STDs, not just HIV specifically, and the reason for that is because there used to be posters put up. Let me see if I can, oh, it's not on this phone, I don't think. There used to be posters put up. Let me see if I can find one on this Instagram account. It'll take me like 3 seconds. If you have any questions, no matter where you're watching, ask away. Let me look up this young man's account. Pardon me, my tummy. Well, fighting for our lives, AIDS Candlelight Vigil. We were just talking about HIV. And he had kind of some information about HIV, you know, and kind of relating it to a viral infection now. Also, he kind of made that connection. Here it is. I hope you can see it. I'm going to make it so you can see it if I can. Okay, it says 4 out of 5 don't even know they have it, or don't know they have it. Let me show you. 4 out of 5 don't know they have it. This was a poster trying to prevent, sorry, you can't see it, trying to prevent the chlamydia, from going around. Why? Because 4 out of 5 people have it and don't know. Well, what's that called? That's called asymptomatic. Just like all the people that can run around now in the US with COVID-19 and be asymptomatic. Asymptomatic does not mean you're not contagious. So, I wanted to show you those examples. Now, another thing about STDs too that I think is interesting to talk about is herpes. Herpes used to be, it's also a viral infection, and it used to be something that nobody talked about. Nobody mentioned it, but there were so many people, and probably still are, walking around with it because it's a virus, a viral infection that, from what I understand, when you first get it, you might have symptoms and they might be bad, and then the virus lays dormant in your body until you have another outbreak, another flare-up. So this is very similar to me to COVID-19 because, again, you can be asymptomatic. So the good news now is that over the past few years at least, herpes, the full name is herpes simplex, is not such a thing that nobody talks about. It's not such a hidden thing anymore. You see commercials on TV for medications, the antivirals that try to help fight somebody who has herpes from getting outbreaks. So there are so many viruses through history and things that you can be asymptomatic and still spread it. So these are some good examples. Yes, I know that you probably don't want to talk to your children and say, hey, it's just like sexually transmitted diseases. I get that. But share it with the adults in your life then, because it's a good kind of analogy to what's going on today. All right. Let me make sure I hit up on all the topics I wanted to and get more comfortable. Okay, someone asked me, that wasn't comfortable. Let me move again. Someone asked me, how do I know if my job is essential? Well, I'll give you my best guess and from what I've read, but I would assume that either the governor in your state or whoever made that announcement, your company, I would assume somebody of that nature is going to let you know. But in my estimation and from what I have read, Basically, people who keep a modern civilization going are essential. That is anything from people who work in the grocery store to people who work in the pharmacy, tractor trailer drivers like my brother taking supplies across the country, logistics people and UPS package handlers, stuff like that, utility company employees, so the lights stay on and all of that stuff. Being that we are such a modern society, I would assume that people who make sure the Wi-Fi is going, whoever you have your Wi-Fi through, that's probably essential too. So there are many, many more other than that. Of course, first responders, of course, medical staff. But if you're not sure if your job is essential or not, just go ahead and reach out to the company you work for. I'm sure that the manager, the owner, whoever you can get in touch with, would be able to give you specific guidance on that. But that's my estimation. Okay. Somebody asked again, how can I help? We did talk about this at length last night, so I'll just quickly go through them. You can donate blood, but there's a particular way you need to do it now. The Surgeon General put out the call yesterday, and he said today already, by today already, the numbers are going up, so that's awesome. You need to do it by appointment. So instead of just walking in to donate blood, you have to call and say that you would like to come in and do that. And there are extra sanitization procedures going on. They take your temperature when you come in the door. Of course, the volunteers there are having all this done too. But they take your temperature when you go in. They sterilize everything before you sit. After each donor, they sterilize everything too, which I would have hoped they were doing before. But donate blood you can do. It just came into my head. You might be able to donate plasma too. They didn't specifically ask for plasma, but if there's a plasma donation center near you, you can do that too. I would assume that would help right now. Another thing I mentioned was to help your neighbors, especially the elderly and those with immune issues. You might want to offer them to go pick up something if they need it from the store, or even if they're uncomfortable going to the store alone because they're not sure if there's going to be a bajillion people there, or if they're going to have to fight for an 8-pack of toilet paper or whatever. See if you can help your neighbors that way. We talked about if you have masks and you're not sick, you might want to consider donating them. I know a lot of people thought we're going to need masks for this and they bought them, but they're realizing they don't. So you can watch earlier in the video, and also yesterday I kind of explained what I think the proper procedure would be to do that. Don't open the box of masks and take out what you want. Leave it closed. Call the hospital. Say, I have a box of masks. I would like to donate 90 of them to you, and I'll keep 10 from the box of 100, give you 90, and then that way I'll have some for my family if we need it. Another big thing is, two big things. Follow the guidelines, please. I have said this a bunch of times that people are like, 15 days, oh my God. Well, we're trying to stop a viral infection from crossing our country and making millions of us sick. So I think you can sit in your house 15 days with your Netflix and your Hulu and your Wi-Fi and all the stockpile that you have. And you can make a nice little couch out of your toilet paper and your paper towel, and you'll be comfortable. So I think we can manage 15 days in our houses. But I'll tell you what, if we can't, on day 14, they're going to add a lot more days. And I don't know how many it could even be. So do what we're supposed to do, and we'll get out of our houses sooner and get back to regular, everyday American life. Another thing, this is a big one, and the task force is starting to really mention this in the press conferences. Don't spread misinformation or unverified information. You can always share the information that I do. That is always safe. It is always sourced. Even if the source is like my experience from, when I went to Ground Zero in 2001 in November, I put that. So you can always be sure that what I'm sharing is verified, good information to share, and accurate information. No mis or disinformation. In fact, I am going to tell you this because It's not really disinformation. I don't really know what to call it, but here we go. So there was somebody who made a comment on a post that I put up about, I don't know, a couple days ago. All the days are like running together and I don't know what I did on what day because I've been doing so much with this. But I put up a post that's like, the majority of people who get this will have mild symptoms. And somebody commented, that chest pain ain't mild. Well, I responded like this with an emoji, because that to me is a scare tactic. There's no information, and I'm not saying he meant it that way. I'm saying that's the way people will perceive it. There's no source for that. There was no explanation for that. That chest pain ain't mild. So I responded with a rolling eyes emoji, which pissed him the hell off. Well, okay. And he was saying, I think I have it. I'm paraphrasing. He was saying, I think I have it. My chest really, really hurts. You know, you don't know anything about me. You don't know my experience. You don't know this. You don't know that. Well, it's kind of true. I mean, I know who he is. I know the company he has, and I've seen a lot of his posts. He has a lot of very interesting posts about what his company sells. But what I said to him was, look, even if you have it, that is your experience. That does not mean it's going to be the experience for everybody or the majority. When the health officials are coming out and saying these are going to be the symptoms, and you contradict that, shouldn't you be accountable for that? Like, it's one person's experience. I think, I mean, it's of course sad that his chest was so uncomfortable, but in a situation like this, accurate information is very important. Now, that kind of went back and forth a couple times, but the end result is I saw him post today that he remembered that he was doing something with some frozen fruit. It sounded like maybe trying to break it apart, and he did it against his chest, or somehow it was against his chest, and that's probably how he heard it. Now, if you are the person who wrote this and you're watching this, I'm not making fun of you. I'm not calling you out. I'm not saying your name or anything. But that's a good example of just kind of scaring people, in my opinion. So yeah, I don't know if he had it. I don't know if he has it. I don't know anything like that. But what I do know is it's not accurate information, and it's not helping anybody to do something like that. So don't share myths or disinformation. I already explained how shelter in place versus what is means versus what New York State is doing. I said that in the beginning. Somebody asked, why are you using that Coronademic word? I think you forgot the hashtag. I didn't. I was using the hashtag at first, but the way that hashtags work, especially on Instagram, is if you put a hashtag that no one is using, it's like broken, then you get shadow banned. So I stopped using the hashtag. I only used it the hashtag symbol a little bit, but I did register Coronademic as a hashtag. No, that is no financial gain for that whatsoever. I just did it because if people want to see what is this about, I don't know, 10 years from now when everybody forgot about COVID-19, or if somebody saw it and they want to understand what it's about, I registered it. So I'm going to go and kind of fill in some information there. But basically the reason I put that word at the end of all of my posts after the wash your hands emojis, right, is because I'm getting a lot of questions from a lot of people, and I want to help as many people as I can. So if I don't have a lot of time when somebody has a question for me, or I'm afraid I'll forget and I won't get back to them later, I just say, hey, I made all the COVID-19 posts on my personal Facebook page public, or you can search on my page for the word Coronademic and they will all come up. So that's really what it's about. Yeah, so that's what that's about. Okay. Let me see if I got everything. What time is it? 9:20. Oh, I've been talking for a long time. Okay. I think that was everything. Yeah, I thought maybe it would be fun to start sharing some recipes, what you guys can do with all the stuff that you're hoarding. Obviously, I don't have toilet paper recipes, or, well, actually, paper mache. No. Mostly food recipes. A lot of the stuff that people decided they needed in their home, like cans and cans of beans, I know what to do with. The video I shared yesterday was pretty funny, that the woman bought all these cans of beans, and she's like, cans of beans, cans of cooked beans in liquid. And she said, I don't know why I bought these beans. I've never cooked with them. Not only was that pretty funny, but it's pretty funny that you don't even have to cook them, actually, in that particular way that you bought them, in a can, already cooked. You just got to open them, maybe microwave them. That's all you got to do. So I love to hear these crazy supplies that people bought. Let me just make sure, because throughout the day, I'm like copying and pasting text into a notes app about stuff that I want to cover. Just want to make triple sure. All right, let's talk just one more time about YouTube before I go. And if you have any other questions, go ahead and submit them. Then I'm going to jump off here in a minute. Again, I've still kind of, you know, I don't think it's really hit here too bad in Arizona, but the reason I'm backing off of this, I still want to inform you guys, but I want to get my house like cleaned, ready, just in case I do get sick, and, you know, just clear off kind of a guest room kind of situation, just in case anybody in the house gets sick. We have like a quarantine room ready to go and all that stuff, and everything organized and all that, so I don't have to worry about it if I don't feel good. So yeah, I started doing the lives on YouTube. This is the second night. It's just, like I said, I don't get any ad revenue for it. As of me coming on here an hour and 20 minutes ago, I had 13 subscribers. I'm not even close to ad revenue at all whatsoever. But it's a bigger platform that's meant for this kind of stuff, and they can get the message out to more people. That's why I did it. That's all I have for you guys tonight. I hope you're staying safe. I hope you're staying healthy. If you do have any questions, let me know. I'll be back tomorrow with another live. I would really like to try to do them earlier, but the fact is that news keeps coming out until 4, 5, 6, 7 to 8 o'clock Eastern time. And then I need some time to kind of prepare and organize everything, make dinner, all that stuff. So probably going to have to leave them at 8 o'clock. But if you have any feedback on that, let me know. Let's take a look at our labels that I put the alcohol on. So yeah, it kind of ran a little bit on this one when it didn't at first. But this other one, the first one that I sprayed, can't even tell. That's interesting. So, hey, I learned from my experiment too. By the way, I had to laugh. I know I said I'm going to go, but I had to laugh about my pharmacy meds that I got today, because I don't want to go out and grab it and show it to you, but I can. All right, so this is like the regular size of a prescription bottle usually, and that particular medication that I had to get today, I get 30 tablets of, right? So it fills maybe to there, maybe to there. So the prescription I got today, those same 30 pills, I'm sorry, it's just funny to me. It was in a bottle like this big, like 5 inches big, and like this big around. It was crazy. I'm like, okay, I see the little bottles they weren't kidding. They're very busy. So it was kind of funny that I had that big ass bottle. But that's all I have for you guys for tonight. I'll be back tomorrow night. If you have any questions, let me know. Stay safe, stay healthy, wash your damn hands. Stay in your house if you're supposed to. Come hang out here with me at night. Be entertained. Have a good night, guys. Bye. Are you coming in?